So, doctor, I would like to ask a question. If with the patient, he is severely, like the doctor didn't mention how much score is this. So, score is very important in this regard, because if it's 8 or 7, then we can know. So, how the severity is. And if we didn't ask physiotherapy. If the again the consultation go towards the whether he needs the high potency of the medication, then we are adding to the codeine to it. And if we need, and he is like a professional player, then what we have to do, we have to refer to the physiotherapist in this regard, or we do is self-limiting, or it's affecting again is a bread and butter is involved, then what we do.
Okay, let me tell you what we would do. So you would explain this way. Okay.
Thank you, Dr. Maria.
Okay. You would explain this way, Lita. What you have told me, and according to my assessment, this is something what we call is costochondritis. You explain costochondritis and you start with reassurance. So 4 points of management. Reassurance is self-resolving thing. At the moment, the best medication is that, as it is inflammation, ibuprofen is the best medication, which you can get over the counter. You don't need to prescribe even NSAID as well. You will get over the counter ibuprofen, and that would help with the inflammation. Okay, first point. Then second point is that, yes, it can take 2 weeks to months to get resolved. But if this pain gets worse and it's no relief by ibuprofen, I'm happy to see you again in 2 weeks' time, and might consider some steroids to decrease that inflammation, steroid injection. Physiotherapy is not recommended here, but you can tell that ice pack or something like that if you suspect that she got any injury. One more thing you can ask in the advice, if she got any injury over there, or maybe she elbowed by someone over there, you can say that, try to take a deep breath, try to take the feel pain. And because sometimes something like if you don't take deep breath properly, you might get some infection of chest. Okay, you have to take normal breaths like this so that you won't develop any chest infection. So if you are suspecting it's a rib bruised, or she's a sports person or everything, you can add on that. But here, the physiotherapy is not recommended because you are asking her to not to do the similar movements which she got to get the inflammation. I just shown you the leaflet for costochondritis. It is not given.
I'll just quickly add something. There is something which is called strapping. Especially when the athletes or the gym people come and they have costochondritis, it becomes very painful for them to move even otherwise. And sometimes they cannot leave their job. Even if they don't exercise themselves, they have to be there. So what you do is you strap their affected part. It's like a crepe bandage or thing, and it limits the movement.
Yeah, 100%, depending upon where it is. So when you will
that is also... If the profession is related to that, you could always offer that, and the severity is more. Dr. Maria, the lollipop is yours.
Well done, Maria. So you asked that question. So here, I won't recommend you to ask for the physiotherapy. Examiner won't be giving you any score for that because it's something related with that would help from steroid. Okay. So, but you would explain the points. It's an inflammation. You can say that where your ribs join the bone in the middle of your chest. It's called breastbone. That's why you're having a sharp pain when you're moving, you're breathing, you're having that pain, and it is usually moving your upper body, and you safety net about a few other things. So let's move to the next scenario. So Ramesh, you want to be doctor now, or anyone else? Okay. So out of the cardiovascular scenarios, there is an important scenario nowadays. Dr. Saira, can you become a patient? That.
Yes, sure.
Can you give her aortic aneurysm?
Oh, great.
Abdominal aortic aneurysm. Then we'll do some headaches and few other things.
Okay. So I'm...
calibration. Yes, calibration as well.
So, okay, all right. So I am John Smith. I am 65. And I have had this pain once before, but right now it's kind of unbearable. And so I have come to the A&E with it. And there's a lot of positive family history considering the vascular risk. And he's otherwise retired, but he's very active, and it's limiting his movements, and he will have lots of concerns about his condition also. Yeah, that's about it.
All right.
The timer, you will keep your timer yourself?
Okay,
Yes.
what else?
Yeah, okay, no problem.
Dr. Ramesh, you're doing?
Yes, I'm doing the time.
Okay, go.
Are you ready?
Yeah, I'm.
Enter the room.
Hello, examiner. This is Dr. Ramesh Khan, GMC number 7995377. Hello.
Hello.
Hi, this is Dr. Khan, one of the doctors in the GP. Could you please confirm your full name and age for me?
Yeah, I'm Peter Smith, doctor. I'm 65.
Okay. Is it okay if I call you Lita?
Oh, yes, Peter is fine. I'm a man.
Okay, sorry, man. Okay. So, how are you doing today, Peter?
Well, doc, I have this pain in my chest and middle of abdomen. It's quite nasty this time.
Oh, I see. And is it okay for you to continue the consultation with this pain?
Yes, I could if you make it quick, doctor.
Okay, yes, I'll just make it quick. Just a few questions about your pain and your general health, and I'll be just having a look at you. Just please bear with me for a few minutes. Would that be okay?
That's fine, doctor.
Okay, so Peter, you are talking about this pain in your chest and your tummy. Can you please tell me a bit more about the pain? Like, when did it start, and was it the chest or your tummy first?
Well, it's right between the chest and the tummy, doc. Right here,
Okay.
and this time it is bad. It's I would say it's unbearable for me now, and it is there for the last an hour or so, doctor.
Okay. And can you tell me that what kind of pain is it? Is it sharp, dull, aching?
Oh well, it's more of an aching, but it's there constantly, doctor.
Okay, all right. And anything that's making the pain worse?
No,
Okay, and anything that's making it better?
nothing at all. I took a couple of paracetamol too, but it didn't work, doctor.
Okay, I'm really sorry that it didn't work, but don't worry, I'm here for you. We are just going to just have a look at you and then